Hello, class. We're about to do another Explain Everything, and this one is about epilepsy. Okay, let's talk about seizures. Seizures disorders have many possible causes, and your book breaks them up, recurring and age. The most common causes of seizure disorders in the beginning of life, your text talks about having birth traumas or congenital abnormalities, inborn errors of metabolism. In people between 2 and 20 years of age, they talk about infection and trauma, and also genetic factors. As we get older, the 20 and 30 years of age, seizure disorders usually occurs as a result of structural lesions, such as trauma or brain tumors or vascular disease. After age 50, according to your text, the primary cause of seizure disorders are stroke and metastatic brain tumors. Okay, so after looking at that, we look at the fact that 30% are idiopathic generalized epilepsy. And these type of seizures, there is no specific cause. So as usual, we're taking a careful history and physical on our patient and trying to ascertain the cause of the seizure activity. Again, what are seizures? They are abnormal misfiring of the neurons in your brain. You have to remember that your brain is composed of thousands of neurons, the cells that process and transmit information. The firing of neurons can be seen in an EEG, which is one of the big tests that is done to diagnose and see that rapid misfiring of the neurons. Typically, one EEG does not diagnose a person as having a seizure disorder. They may even miss that particular rapid misfiring on an EEG, so typically there's more than one done. Multiple misfires can lead to seizure activity. Now, let's look at seizure causes. We've been alluding to the fact that seizures can be primary versus secondary. Primary seizures have no apparent cause, or the idiopathic generalized seizures would be considered primary. Secondary, as a symptom of some other type of condition. So tumors and traumas and metabolic disorders and electrolyte imbalances can cause secondary seizures. If you have a tumor, think about it causing tumor and trauma can cause increased intracranial pressure. Metabolic disorders, think about your diabetics that can have seizures. Think about in electrolyte imbalances. We talk about sodium imbalances causing seizures. Anything that causes an alteration in intracellular osmolality or depletion of essential cellular things that are necessary for essential cellular metabolism, or accumulation of toxic substances. All of these things can cause secondary seizures. So what does a person need to do? They need to avoid stress, lack of sleep, emotional upset, even alcohol and caffeine, increased physical activity. All of these things can cause or bring about a seizure in your patient. You have charts throughout your book, so make sure that you are looking at them. So what should your patient do? They should learn relaxation techniques. They should definitely comply with the medication regimen that is prescribed by their physician. Oftentimes it takes a trial and error to find the right type of medication for your patient who has been diagnosed as epileptic. You can look at drug therapy on page 1423, your drug therapy, 1423 in your Lewis textbook. And again, we are in chapter 59. Drug therapy is in table 59-9. So it separates the medications into those that are used for generalized tonic-clonic and focal seizures, and those that are used for absence and myoclonic seizures. I like the fact that your text is continuing to give you geriatric considerations and is consistently providing you with medication alerts. So please be cognizant of that. There's also a Power RN on YouTube that talks about seizures. What could some of those precipitating stimuli be? People that have seizures, you think about children that are playing video games with all of the lights and the flashing. So people need to kind of keep a diary. We're always talking about diaries, right? And they need to figure out what happens before they have a seizure. They may not remember what happens after they start having a seizure, but they can try to focus on what happened before it, what was the precipitating stimuli, and work to reduce or remove that particular type of stimuli. There are two types of or classifications of seizures. We look at generalized seizures and we also look at partial seizures. So what is the difference? In a generalized seizure, it typically involves both sides. The rapid misfiring involves both sides of the brain. They can start in all parts of the brain with no identifiable onset. They can happen simultaneously. If the source is not identifiable, surgery is usually not an option. Later on, or as you're reading, you'll see that different types of surgeries can happen for seizures that are continuous or refractory, not remitting. But if they cannot find a place of origin, then this may not be a viable course of treatment for a patient having a generalized seizure, just because they start quickly and they end quickly. That's one of the reasons why you may miss this type of seizure on an EEG and why you need to have more than one EEG done. Now, the partial seizure. Partial seizures are either simple or complex. Again, so partial seizures are also called focal seizures. There's a chart on the top of page 1421. Please make sure you look at it. They are also again called partial because they generate or they occur in a limited area of the brain. So again, make sure you're looking at how the seizures originate. Focal seizures begin on one hemisphere of the brain in a specific region of the cortex. And again, that can be diagnosed on an EEG.